Welcome to The Explainer. Today we're talking about anorexia nervosa, a really serious health condition. We're going to break it down with some clear, direct info to help build a better understanding of what it is, what to look for, and how recovery is absolutely possible.
Okay, let's dive right in with the single most important thing you need to understand, and this quote says it all. Eating disorders are not a choice. Anorexia is a serious mental illness, and getting that right from the start, well, it's crucial for everything else we're going to talk about.
So what exactly is anorexia nervosa when you look past all the myths and misconceptions? Let's get into a clear, straightforward definition.
At its core, it really comes down to three key things. First, severely limiting how much food you eat. Second, an overwhelming, intense fear of gaining any weight at all. And third, a distorted body image. And what that means is a person can literally look in the mirror and see themselves as overweight, even when they're dangerously underweight.
Now here's something that a lot of people don't realize. Anorexia doesn't look the same for everyone. On one hand, you have the restricting type, which is all about extreme control, counting every calorie, skipping meals, maybe exercising excessively. But then there's the binge purging type, which can look more chaotic. There's still that restriction, but it's mixed with cycles of binging and then purging. Both are driven by the exact same illness, even if the behaviors on the outside look different.
So let's talk about how this actually shows up. What should you be looking for? It's so important to know that these signs can pop up in a few different ways. You've got the physical signs, which show the body is in serious distress. Then there are the psychological signs that reflect that intense internal struggle. And finally, the behavioral signs, the things you can actually see that are driven by the illness.
The physical toll is it's so serious, and it goes way beyond just being thin. Things like fainting, feeling cold all the time, or a woman losing her period, these are critical signals. They're not small things. They're the body's way of showing it's starving and in distress.
And you know, the battle going on inside is just as severe. The psychological signs really pull back the curtain on the intense mental toll of this illness. It's not just about food. It's this constant, draining preoccupation with weight, this deep-seated anxiety, and this really rigid way of thinking that can make just getting through the day feel impossible.
This brings us to a really crucial point. When you see behaviors like obsessive calorie counting, or someone constantly avoiding eating with other people, or exercising way too much, these aren't just quirky habits. You have to see them for what they are. They're symptoms of the illness, actions that are completely driven by all that psychological distress we just talked about.
So that leads to the big question, right? If it's not a choice, then why? Why does something like this happen? Where does an illness like this even come from?
Well, the honest answer is we're still figuring it all out. But what we do know for sure is that there is never just one single reason. It's more like a complex puzzle, or a perfect storm of different factors coming together.
So instead of a single cause, think of it as a combination of risk factors. There might be a genetic link, we know it can run in families. Then you have cultural pressures, like the media pushing this ideal of thinness. Stressful life events can act as a trigger. And then there are the psychological factors, where controlling food becomes a way to cope with anxiety or feelings that are just too overwhelming.
Okay, now for what is, without a doubt, the most important part of this whole explainer hope. With the right support and the right treatment, recovery from anorexia is absolutely possible.
And this is so vital to understand. Even if someone has been living with this illness for many years, a full recovery is still achievable. Now, the journey isn't easy. It can be long and challenging, for sure, but it is a journey that leads back to a full, healthy life.
So what does that journey actually look like? Well, it's structured, and it almost always takes a team. The first step is just talking to a doctor. From there, getting specialized psychological support is key. Therapies like CBTE have been proven to really help. Usually, a whole treatment team is built, including a dietitian and other specialists. And in very serious cases, hospitalization might be needed just to get the person's physical health stable enough to begin the rest of the work.
So if there's one thing you take away from all this, it's that help is out there, right now. No one, absolutely no one, has to go through this alone. If you or someone you know is struggling, the most important thing is that free, confidential support is literally just a phone call away. Making that call to a helpline, it can feel like a huge step, but it is such a crucial first step towards getting the help that's needed. You are not alone. And we'll leave you with this final thought. Anorexia nervosa thrives in secrecy, in shame, and in misunderstanding. By talking about it openly and factually, just like we did today, we build compassion. And that understanding, That's the first and, honestly, the most powerful step we can take toward action and toward saving lives.